Good afternoon. I think first of all, I would like to thank for organizing committee to get me here to present with you just a little bit about the Vietnam situation. It's, I don't have anything for disclosure. It's just to go directly to my presentation. Firstly, I want to show you the past. You know, in Vietnam, its population is right now, I think it's more than 100 million people. And but you see, the budget for medical services in Vietnam is right now is still low, only 122 US dollar per person per year. But I'm very happy because the government insurance now pay 80 to 100% for IVTPA and 50% for thrombectomy for any Vietnamese have insurance. And because they recognize that the stroke burden in Vietnam is really high, and if you see the number is 2008, is the number we have more than 100,000 is the stroke deaths the Vietnamese per year, and despite that, it's the first unit, the stroke unit in Vietnam, only is established in 2006. And the estimate is more than 200,000 new stroke per year, but I don't believe it. Why? Because I can show you is the number only in my center. In Vietnam, we have 1,500 hospitals around the country, and this one is I show you only the number of my hospital. Last year we have around 12,000 stroke patients coming. It's increasing every year, but the truth is the TBA rate is still low. It's only 3% in 2016. It's still low, and other hospitals is still more lower. The thing is, look like other Southeast Asia is the traffic is a problem. The motorbicycle is the most very popular in Vietnam, and we found that more than 90% of stroke patients come to my hospital via public transportation. And a lot of, I think Vietnam is, all of Vietnamese have a very special queue for motorbike. So I think about maybe we have a motorbike stroke unit next time. How about with Angel? Angel, I think, is the big milestone in acute stroke treatment in Vietnam, because it's the first Angel program launched in 2017. And we cooperate with all of society, of local and national committee. And 2017, we enrolled 40 hospitals inside the Angel program. And so far, we have more than 70 hospitals enrolled to Angel program. And the first thing we do the standardize the protocol for the stroke team. All of the checklists we provide for all of stroke center, and we support the stroke bed and ask them to reduce the door to needle time, and we encourage them to treat the IVTBA inside a CT scan, and we also organize a lot of steering committee and training program for nurses and doctors, and I think it's changed a lot of Vietnamese doctors always as nurses, and it supports doctors to attend training courses in leading stroke centers. And you can see the number of stroke units increasing by years. 2017, we have only 44 stroke units around the country. 2018, 60, and now we have 89. We hope we can reach this 100 before 2020. And the thrombolysis rate around the country is right now reached more than 4%. And the patient treated is 2019 for TPA is nearly 7,000 cases. And I can tell you a little bit of a rescue in my center in a few months, 2019. And you can see it's a big difference between the TBA rate in my center. Before 2006, we have only more than 200 cases with IVTBA. And when we start the Angel program, we have more than 500. And 2018, we have nearly 1,000 TBAs. And this year, for six months, we have more than 500 cases we treat with IVTBA. And the same story with thrombectomy. Thrombectomy is last year we have more than 400, And so far to October to 2019, we have nearly 600 cases we do thrombectomy. And how about door-to-needle time? This door-to-needle time is right now in my center is 38 minutes, and door-to-crown time is a little bit higher, 143. Why? Because it's right now we have the government pay only 50% of thrombectomy price. So the price for thrombectomy in Vietnam about 4,000 US dollars. So the patient have to pay half. That means about 2,000 for thrombectomy. Sometimes we have to discuss with the family, and we have to sure that they can confirm they afford the price for 2,000. So in 2017, we enrolled only two hospitals enrolled to the rescue registry. And 2018, we have 8 hospitals involved. And 2019, we have 12 hospitals in the rescue registry. And you can see the door-to-needle time is around the country. Now we can see the door-to-needle time in the country is now better and better. It's 45 minutes in 2017, 44 in 2018, and 2019 is about 40 minutes door-to-needle time. And especially we have 4 stroke centers around country receive a gold standard award from ESO, ANGELS program. And the last thing I would like to show you the future. And I think it's with the big population, 100 million of people, I think we need to build up the next stroke network. It's not only 100 stroke units already, which I think we need to create more stroke units and stroke-ready hospital. We want to ensure that there's more hospital can already for TPA, for thrombolysis, is better for stroke patient. And we also need to more data and to control the quality of the stroke care in Vietnam, because it's now we have only 12 hospitals to enroll in rescue. We need more hospitals in the next future. And for conclusion, in stroke care in Vietnam, I think it has significantly improved since joining ANGEL initiative. And stroke patients, I think they already missed the chance for prevention. So we try to give them more chance for recovery after stroke by best quality of acute stroke treatment. And then we want to cut stroke in half, look like Professor Brian said this morning. We want to cut stroke in half for secondary prevention. Thank you for attention.